here are some things that I don't think are okay for therapists to be doing. I have just heard so many horror stories about people's experiences in therapy. I think everybody should have a positive experience in therapy, and it's just really unfortunate that so many people don't have good experiences in therapy. So here are some things that I don't think are okay for therapists to be doing. Texting during session. You deserve your therapist's undivided attention. That goes into like anything that's distractive, especially if you're virtual and the therapist is not in a space that is confidential. Yes, I have heard this before. People should not be coming in and out of the room that your therapist is providing sessions in. That is breaking confidentiality. And then no showing or constant cancellations. I know that things happen, but you should have consistency in your relationship with your therapist. Falling asleep in session. I definitely want to take into consideration the systems that they might be operating in and give grace around that. But for me, if I were the client, I just think I would feel so offended and not feeling like that therapist is showing up able to really give quality care. Invalidating or judging. I don't think you should ever feel judged by your therapist. Of course, we miss the mark sometimes. So if you feel invalidated and that's like not a usual thing, I think that's definitely something that could be addressed. But I don't think you should consistently feel invalidated or judged by your therapist. Telling you what to do. It is not our job to tell you what to do. It is our job to provide feedback based on what we are hearing, point out any discrepancies based on what we're hearing you say. But yeah, it's not our role to tell you what to do. I might have an opinion based on what I think is best if I were in that situation, but that doesn't mean it's best for my client. If I were to tell you what to do and then it doesn't work out, then it's my fault. I don't want that responsibility. Talking about you or giving details about your session on social media. If you can identify that it's you that your therapist is talking about on social media, I just don't think that's appropriate. I think that could really feel unsafe for a lot of people. Nobody's perfect, so it's totally normal for your therapist to miss the mark or forget a detail on something. You really want to look at like what is the exception rather than what is the rule. If you've had a poor experience in therapy, I'm really sorry and just want you to know this does not represent therapy as a whole, and I really encourage you to not give up on finding a therapist who is a good fit for you because there's so many great therapists out there. Hope this is helpful. Follow me for more mental health tips and therapeutic content.